New luau sliders at Tropical Smoothie Cafe.
You're watching Virginia This Morning.
Welcome back. June is Men's Health Month and a great time to make your health a priority and get an annual physical. One of the areas millions of men deal with is erectile dysfunction. Dr. Jason Sabota from Virginia Urology is here with some helpful information. Thank you, Doctor. Appreciate you coming in. Let's talk, let's start at the very beginning. What are the warning signs that a guy might be struggling with ED?
So men will start to experience some changes. It's very important to recognize that and to pay attention to some of those changes that they'll start to see. They'll start to notice that they have difficulty achieving an erection, basically getting a firm erection for intercourse. They may notice that they start to lose that erection, so they start to have a lot of difficulties. Recognizing that and saying, I need to go see somebody and talk to somebody is really important, and that's really the first step. Rather than saying, well, I'm having a bad week, or I think things will get better later, or it must just be something else.
Yeah, well, guys are kind of famous for putting things off.
We tend to do that.
Yeah, definitely. Is this an age thing? Does this definitely have to do with age, or can this happen to younger men?
I think you could look at it as being a little bit of an inevitable disease process, meaning as you get older, you're much more likely to experience erectile dysfunction. But we do see young men, in their 20s and 30s, who are having significant problems with erections. So pay attention to it. If it's something that you're experiencing at 20 years old, come to somebody. But you would expect it as you get older to be more common.
You mentioned you kind of confront this. Why is that so important?
I think there's the obvious reasons in terms of being able to enjoy yourself in terms of intimacy, being healthy in terms of relationship with your partner. A little bit less obvious can be damage that can be caused locally to the penile tissue, basically scarring and curvature. So that can be a very significant long-term problem for folks. And then the less obvious concerns are this can be a sign of diabetes, high blood pressure, and other diseases that clearly are important and need to be treated as well.
So if you're having problems and do what we do and put things off, then obviously this can develop into a bigger problem.
Sure. In
the area we're talking about, but not just that. I mean, diabetes and what'd you say? Blood pressure?
High blood pressure, risk for heart attack. So if, especially a young gentleman, if you're starting to experience some changes, this may be a warning sign and may require you to see not only a urologist, but your primary care doctor, a cardiologist, an endocrinologist, somebody who specializes in diabetes management to prevent long-term problems, not only with sexual health, but all other organs in the body can be affected by that.
I think pretty much everybody by now has seen their share of Viagra and Cialis commercials and things like that. What are some alternatives that men may or may not know about?
Sure. So we have access to different options, different devices that can be used in different ways of approaching erectile dysfunction. And it really can be tailored to what type of problem the patient is experiencing. There are vacuum erection devices and things along those lines. There's injection techniques. Those are more invasive. I try to educate the patient and get them to improve some of the other parameters we've talked about, smoking, weight, exercise, blood pressure, to see if we can try to avoid having to use the blue pill or having to use other devices and things like that, and if we can actually reverse some of the effects. So that's really where I target a lot of the initial discussion.
It's kind of interesting. Smoking and diet comes into everything
sure
that
does.
we talk about with the human body and
yes.
with health. All right, let's get the viewers some more information. Where can they find out more about ED without using the pills?
I think there's a couple good resources. edcure.org. that's a good option to, and this is a little bit more as folks get into some of the more advanced therapies. I think that WebMD, their website is very informative and very helpful. And locally are uro.com, that's uro.com for Virginia Urology, to look at some providers who could then help and have patients come in and work with them.
So there's lots of information out there. We just got to deal with it. Thank you very much, Doctor. We appreciate you coming in.
Absolutely.
Men's Health Month. For more information, just visit our show website at WTVR.com/VTM. You'll find a link to find out more. Stay tuned. Virginia This Morning returns right after a quick break.